Our next witness is known as Di, is he?
That's right, Sir Thomas Griffiths, but known as Di.
Please state your full name.
Thomas David Griffiths.
Take the book in your raised hand and repeat after me. I swear by Almighty God
I swear by Almighty God
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
Di, you were diagnosed with haemophilia when you were 7 years old.
Yes,
And that came about after you'd had some dental treatment, is that right?
that's right, yes.
What happened?
Well, I had a couple of teeth out and they had difficulty stopping the bleeding. This was in Shrewsbury when I was 7, and I had to be transferred to Birmingham Hospital to have the bleeding stopped eventually.
And from that time onwards until you moved to Dumfries in 1971, what kind of treatment, if any, did you receive for your haemophilia?
The original treatments when I was quite young were entire blood, and then during the 1960s it became plasma, and then into the early 70s it became cryoprecipitate, and then a bit later it became factor VIII.
And you were very keen on sport, I understand, as a teenager and young man.
Yes, I loved football and rugby at school, but because of the knocks, I used to be injured quite often and had to be taken away for treatment, and I was missing too much school, so they stopped me playing contact sports at the age of about 13.
Now, 1971 was when you moved to Dumfries and you began to attend the haematology centre at the hospital there.
That's right, yes.
And you were under the care of Dr. Toulis.
Yes.
And so you started off receiving cryoprecipitate.
Plasma still at that stage when I came to Dumfriesshire, and then started on cryoprecipitate shortly afterwards.
And then, can you remember very roughly when it was you started to receive the factor VIII products, the concentrates?
The first factor VIII I received was in February of 1977, and then another infusion a month later, in March of 1977.
Now, how often from 1977 onwards, again very approximately as far as you can recall, how often did you receive factor VIII products?
I had an arrangement with the hospital where if I had a bleed, which I frequently did in the knee joints, I could phone them and they would be ready to receive me to give me either cryoprecipitate or factor VIII. I didn't know beforehand which I would receive, and I don't recall precisely, but it seemed to depend which doctor I saw as to whether I was given cryoprecipitate or factor VIII. But certainly factor VIII on many dozens of occasions, and indeed cryoprecipitate on many dozens of occasions over the next 2 decades.
And you used to go into hospital for your treatment. You weren't on what's been referred to by other witnesses as a home treatment programme.
During the 1970s and 1980s, always to the hospital, but then when home treatment became available with factor VIII, I was very pleased to be able to do the home treatment. That was a huge benefit because if ever I felt a bleed starting, I could treat it immediately with factor VIII, and that would stall the bleeding quite quickly. So that was a huge benefit.
And can you recall again very approximately when you started to receive factor VIII at home?
I think it would be the late 80s.
Now, were you ever given any advice or information or warnings about any risk of infection associated with the use of any of these products?
Not by the hospital. The first I knew of it when stories began to emerge in the middle and late 80s that there might be a problem, or it emerged at that stage in the press that there could be problems with infected blood product.
But just going back to the late 1970s when you started to receive Factor VIII products for the first time, you weren't given any information or advice about any risks of infection?
Not told of any risks at all. The first I knew was reading in the press and Haemophilia press in the mid-80s, I think around about 1985, that there might be problems with infected blood product.
And were you ever given any choice as to whether to have cryoprecipitate or factor products?
No, I accepted what I was given, yes.
And were the differences between them ever discussed with you by any of the treating doctors?
Not that I remember, no.
What can you recall about the particular products that you were given and where they came from?
Well, it came to a head really in the middle 1980s when I asked of Dr. Toulis, or I told Dr. Toulis and a number of other staff when I was in for treatment, that I was very concerned about the possibility of infected blood product, that I was reading stories about it in the press, and it was causing me concern having to come in for a product which was thought to be not entirely safe. I was told by Dr. Toulis and a number of his staff on various occasions, there is absolutely no need to worry. We never, ever use imported blood product in Scottish hospitals. I was told that by Dr. Toulis, and on later occasions I was told that by some of his staff also. Now, this distressed me because I knew for a fact that for at least 10 years I had been receiving imported blood product. I had seen the labels on the sachets as I was being infused, labels of laboratories in Australia, labels of laboratories in America, where the material had obviously originated. And this caused me great distress that I was being told one thing when I knew it was not true. I took this up with a number of the staff, and I was given the same story every time, that imported blood product has never, ever been used in Scottish hospitals.
So the assurance that you recall being given was not simply limited to Dumfries Hospital, but to Scotland generally.
That's right.
And you have a recollection, as I understand it, in relation to the cryoprecipitate that you received, of seeing labels from Perth, Australia.
Yes, on many occasions.
And in relation to the factor products you received, you have a recollection of seeing Baxter.
That's right.
As one of the products that you received.
Yes, Baxter's of America.
So I should say that Dr. Toulis has been asked for a response, and we understand does intend to provide a response which will be published in due course.
Yes, well, I shall welcome one.
I might say that this caused me quite a bit of distress, because when I brought the subject up with the staff, I could sense that this was causing quite a bit of conflict. So I fairly quickly realized that I could not pursue this because of the conflict that was evident, and I couldn't afford conflict with them because I needed treatment fairly frequently, and that I couldn't allow the relationship to deteriorate.
Now, how was it, Di, that you found out that you had in fact been infected with hepatitis C?
I received a letter on the 2nd of December 1999 to inform me that recent blood tests had confirmed that I was hepatitis C positive.
We'll have a look at that letter, Di. Paul, it's 2148006, please. and we can see it's dated 2nd of December 1999. It's a letter from Dr. Toulis to you, and it says, one of the blood tests I checked at your last attendance at the blood clinic shows that you have been infected with hepatitis C virus. In all probability, this may have occurred some years ago in association with transfusion of factor VIII or other blood products. The tests also suggest that you still have the virus. There are treatments now available, and I've asked a colleague with an interest in this subject, Dr. Gwyneth Jones, to see you in the near future. If you have any concerns in the meantime, please do not hesitate to give me a ring. That was the first you knew of your infection with hepatitis C.
It was.
And you did, as I understand it, ring Dr. Toulis or speak to him.
Yes, we were just back from holiday, and my wife was away shopping. And I gave Dr. Toulis a ring immediately. I'd read this letter, or read it several times. And I said, well, it's not good news, hepatitis C. How long have I had it? How long have you known about it? And he said, oh, it's possibly some time ago. And I said, well, how long? He said, well, I can't really tell you. So I said, well, it's not good news. And he said, well, it's nothing to worry about. Hepatitis C is nothing to worry about. You may experience mild flu symptoms, but nothing worse than that. And the important thing about hepatitis C is that it's not life-threatening. It is only life-shortening. And I just replied that I couldn't really see much difference between the two.
And you said in your statement that you understood from your conversation with Dr. Toulis that he had known for some time that you had hepatitis C, but had not informed you. Can you recall how that part of the conversation went?
I think I said to him that I feel I should have been informed when you discovered that I was Hep C positive. And there wasn't much of a reply. He just said, well, if you want to discuss the matter further, you can come and see me. So this led me on the trail of wanting to see my medical records. That took at least a couple of years before I was able to access them, because the hospital at first refused to allow me to see my records. They said it was not their policy to allow patients access to the records. I tried again, was told again, or told on the second occasion there was no one available to show me the records. So this process took, there were several letters went to and fro, and I eventually got access to the records nearly 2 years after this event. And I discovered in the medical records that I had tested positive for hepatitis C in 1991. So late 1990. So they had actually known for over 9 years that I was hepatitis C positive.
We'll just have a look in a moment at those records. But before we do that, I'm just staying for a moment with the communication by Dr. Toulis of this information to you, first of all in the letter and then the subsequent telephone call that you had. Were you given any other information about the nature of the condition or its progression or possible treatment options?
No.
Were you given any information about risks of infecting others?
No.
And had you been aware in 1999 that you were even being tested for hepatitis C, if tests were being undertaken there?
No, I had not been told at any stage that I was being tested for hepatitis C.
And then if we just look back at some of the records, and they'll come up on the screen in front of you, Di. Paul, can we have 2148007, please? This is a letter dated the 2nd of November 1990 from Dr. Toulis to your GP. It refers to having reviewed you at the blood clinic that day. And then it says this: I have checked his hepatitis and HIV status and have given him a review appointment for 1 year. Now, it doesn't actually tell us what the outcome of any checks were, but were you aware in November 1990 that your HIV and hepatitis status were being checked?
No.
And were you given any information about the outcome of those checks?
No.
I understand from the records that you did obtain that they also showed that as long ago as February 1977, you'd had tests for hepatitis B shortly after your first factor VIII treatment. Were you told of that test or the results?
No, but I was told, late 70s or 1980-ish, that I needed a hepatitis B vaccination.
And your records also contain an HIV test which was negative from mid-1985. Were you told of that test
No.
or the result? And then returning to the hepatitis C tests, if we have up on screen, please, 2148008, please, Paul. We can see the date here is the 1st of November 1990. And then if we go to the test results, bottom half of the page, please, thank you. We can see their reference to hepatitis B and hepatitis A, and then a ref lab comment, positive for antibody to hepatitis C virus. Were you aware that those tests were being undertaken?
No.
Were you told the outcome of those
No.
tests? Could we have up on screen, please, Paul, 2148009? We can see the date here. It's almost exactly a year later, 7th of November 1991. And we can see, if we look at the test results, please, halfway down the page, Paul, positive for anti-hepatitis C virus confirmed by REBA2. Were you aware that those tests were being undertaken in November 1991?
No.
And were the results of them communicated to you?
No.
Now, could we have up on screen, please, Paul, 2148002? These are some handwritten medical records, and we can see a date, 7th of November 1991. And we can see in the left-hand column, there's reference to LFTs, liver function tests, then Hep B and HIV. And then if we just go a little further down the page, please, Paul, we can see there a reference to never had Hep B vaccine, question mark, immune retest, HIV done in the past, negative. Do you recall any discussions with you in November 1991, first of all about HIV?
No.
There's a reference there to never having had the hepatitis B vaccine, and you do, I think, have some recollection of a discussion about a hepatitis B vaccine.
Yes, as I understand it, they wrote to my GP, and my GP called me in to have a hepatitis B vaccine in the local surgery.
But still nothing being told to you at all about hepatitis C?
No.
And then if we come forward again to 1999 and have up on screen 2148003, please, Paul. So we can see the same date that Dr. Toulis wrote to you. He's written a letter referral to Dr. Jones, 2nd of December 1999. I'd be grateful if you would see this mild haemophiliac, who has, although mainly treated with DDAVP nowadays, received factor VIII in the past. He's hepatitis B core antibody negative, but HCV positive, and also HCV PCR positive. His liver function tests are also greatly deranged, and it goes on to describe, to refer to those. Were you told that your liver function tests were greatly deranged, or words to that effect?
No.
If we look, please, at 2148004, we can see here, if we could have the table highlighted, thank you, Paul. We can see here a table of liver function tests, and we've got a test on the 7th of November 1991, and the elevated results, and then 8th of November 1999, we have the results which are presumably those being described by Dr. Toulis as greatly deranged. Did you have, as far as you know from looking at your records, any liver function tests undertaken between 1991 and 1999?
Not that I'm aware of, but I can't be 100% sure about that.
And we can see from the liver function tests effectively a deterioration in your liver functioning in those 8 or so years. Now, if we have up on screen 2148005, please, Paul. We can see here a letter from Dr. Jones, the physician to whom you've been referred by Dr. Toulis, to Dr. Toulis, dated the 10th of February 2000. It refers in the second line to you feeling unusually weary in the last 6 to 12 months with mild abdominal discomfort. Can you recall beginning to experience symptoms of fatigue and weariness at that time?
Yes, I was not 35 at that stage. I think I was probably 55 at that stage. I was aware during the 1990s, 1990 onwards maybe, I was aware of lacking in energy and getting tired more easily than I was accustomed. We were leading a very busy life, a very busy hotel, and working very long hours. And I was feeling very gradually a loss of energy, not able to work quite as long hours as I was used to or wanted to. And I rather put this down to the effects, long-term effects of haemophilia maybe, or the onset of middle age, I don't know. But I knew I wasn't as fit as I had been previously.
And if we just look at the second page of this letter, we can see Dr. Jones saying this: I note on reviewing his previous results that hepatitis C was first diagnosed in 1990, and it would appear that he's received hepatitis B immunisation. The only previous liver function test dated back to that time when both AST and ALT were mildly elevated. It would appear likely that the more recent deterioration related to progression of his chronic hepatitis C, and clearly he would be a candidate for combination treatment with interferon and ribavirin. So Dr. Jones is here recording that it's apparent to her on reviewing your records that the diagnosis was first made in 1990.
Mm-hmm.
Now, you then, in terms of your hepatitis C, came under the care of Dr. Jones. Mm-hmm. But it was a while before you received or started to receive your first course of treatment for hepatitis C. What happened? Why was there a delay?
Well, when I was informed by Dr. Toulis and Dr. Jones that there was treatment available for hepatitis C, I said I would like to go ahead at the first possible opportunity. So Dr. Jones gradually made arrangements for me to be put on the list. But I think it was about 20 months from the date of the hepatitis C letter. It was about 20 months until August of 2001 that the treatment with interferon and ribavirin actually started. So I felt at that time it's time wasted. And I actually wrote, I think, 4 letters to Dr. Jones asking that the treatment be brought forward if at all possible. But it took rather longer than I hoped.
And do you know any reason as to why that was the case?
Not really. Whether it was shortage of supply of interferon or ribavirin, I think that's possibly the most likely.
You did embark upon your first course of treatment with interferon and ribavirin in August of 2001.
Yes.
What can you tell us about that treatment and the side effects that you experienced?
Yes, I started in August. Dr. Jones warned me thoroughly that it was not going to be a nice experience, that she told me about all the side effects I would have to endure, and I was well warned before it started. But I thought, well, no matter how tough it's going to be, it's better than the option of a seat in the departure lounge. So I decided, I would like to go ahead as soon as possible. I managed to, the side effects were precisely as she described. I had terrible loss of sleep. I couldn't sleep more than 2 hours a night. I had a lot of shaking and trembling, and skin was coming out in lesions which were itchy and irritating. I think the worst thing was the loss of sleep, but also the concentration levels just went haywire. And there was certainly a change of personality. I became quite irritable, as I have a witness here to confirm. So it was a tough treatment. I only lasted 4 months, and one occasion I was in the hospital for a checkup on this treatment. And I actually passed out in the presence of Dr. Jones because I was so tired and in such a bad state. And she decided there and then that the treatment had to stop, much to my disappointment, because I was absolutely determined to see it through.
And you said in your witness statement that you also felt constantly nauseous.
Yes.
That you became increasingly stressed and then deeply depressed, and you appeared to have a total change of personality with very dark moods.
Mm-hmm.
You then, as you say, had to stop the treatment did stop the treatment after 4 months.
4 or 5 months, yeah.
Your liver function was checked on a regular basis. And then in December 2003, what happened at a routine liver appointment?
I started off with liver function tests every 6 months and scans every 6 months. And then after about a year or 2 years of that, Dr. Jones put me on 3 monthly scans of the liver. And the scan in December of 2003 showed a tumour had developed, tumour the size of an egg, maybe. So it was decided that being just before Christmas, immediately after New Year, I had to go to Edinburgh Royal Infirmary for an assessment for a liver transplant. So they put me through a thorough assessment for that and found I was a suitable candidate for a transplant as soon as a liver became available.
And you received the phone call at home from Edinburgh on the 13th of February 2004 telling you that there was a suitable liver donor.
My lucky date, Friday the 13th.
And you were taken by ambulance to Edinburgh Infirmary and you had the liver transplant. Mm-hmm. And that was successfully performed and you were discharged home after 13 days.
Yes. A brilliant team.
Now, you continued to receive regular checkups at the Royal Infirmary, or the Edinburgh Infirmary, and you've said it was on one of these appointments it was discovered the hepatitis C was still active. Mm-hmm. And it was in 2005 then you were offered a second course of treatment. What can you tell us about that?
Yes, the test was showing that the hepatitis C had become more active again and there were signs of liver damage to the new liver. So I was advised that the best thing to do was to go for the interferon and ribavirin treatment again for 12 months. So it started pretty well immediately at that stage.
And how was that in terms of side effects?
Not as bad as the first occasion. I think the new liver was probably helpful in that respect. And although the side effects were still quite bad, they were maybe 20-25% easier than the first exercise.
And you completed that treatment over a 12-month period. Mm-hmm. And what was the outcome of that second course of treatment?
It was evident towards the latter part of that year that the hepatitis C virus was being reduced substantially. And by the time the 12 months had passed, I was clear, although the side effects of the drug still persisted, as I had been warned, still persisted for another 6 months or so. But they kept testing me regularly for hepatitis, and fortunately it didn't reappear.
And following the identification of the cancerous tumour and the liver transplant, and then your second course of treatment in 2005 for the hepatitis C, how has your health been since those events?
Absolutely wonderful. I've had a new lease of life. It's brilliant.
And in fact, you no longer have haemophilia?
That's right. The liver transplant cured the haemophilia, which was a fantastic boon at the age of 60, to be rid of that thing.
But in that intervening period, the fatigue, unknown to you in the 1990s that you had hepatitis C, and then the subsequent courses of treatment and diagnosis and the surgery that you had to have. How did that impact upon your life?
From very low to very high. I certainly felt a tremendous new lease of life after the liver transplant and clearing the hepatitis C. And it was only at that stage that I realized that during the 1990s I'd been unwell. And all of a sudden I had heaps more energy. I felt back to my original self. So that was a wonderful experience.
Now, you'd been running for many years a successful hotel business, but you sold that in the course of the 1990s. And that was in part, but I think you say not completely, but in part because of your fatigue and tiredness and the fact that you were finding it harder to cope.
Yes, it was one element of the decision, but many years previous I had asked Dr. Toulis what the long-term prognosis of haemophilia was, since I was the only one in my family who had it. And he advised me that when you get past the age of 50, you'll find the effects of haemophilia will be more severe and you'll become less and less mobile. Life will actually get tougher. So, I had that in my mind all the time. And when the opportunity came to sell the hotel in 1995, I felt this was possibly the right move to make because I was struggling to cope with the workload, which was very heavy. So it seemed a sensible thing to do, to come out when I could.
Can I go back to the issue of the medical records? Because you've explained the difficulties you encountered in accessing your medical records. When you did finally see your medical records, what did you discover about records of factor VIII treatment?
When I was eventually allowed 1 hour in the presence of a clerk at the hospital, I was allowed 1 hour to look at my records, which were that thick. It was not nearly adequate enough to study what I wanted to study, but I realized quite quickly that the records of my hepatitis C treatments were missing. And even the cryoprecipitate was just one list of meaningless batch numbers.
Do you mean your factor VIII treatments?
Sorry, factor VIII treatment, yeah, sorry.
So there were references and dates upon which you'd received cryoprecipitate, but you don't think that was a full record, and no references other than one to receipt of factor VIII.
Yes.
You're confident from your own recollection that you received factor VIII on numerous occasions?
Many occasions, yes.
Did you receive, or did you ask for, did you receive any explanation as to why there were no or only one record of factor VIII products?
When I asked the hospital why there was no record of the factor VIII treatments, or very little, they told me that these records were not kept.
And were you given any explanation as to why those records had not been kept, but other records had been?
No.
In September 2004, is it right that you received a notification letter about VCJD?
As far as I can remember, yes, but it was just a pre-printed pro forma thing that I didn't study particularly carefully because I didn't think I had a problem that way.
And do you recall, at this distance of time, can you recall anything about what it said?
Not really, no.
Leaving aside the concerns you've expressed about testing and diagnosis and you being given information, you've made the point in your statement that you've had very good care in a number of respects from the NHS, and you wanted to make that clear in particular the care you received at the time of your liver transplant at the Edinburgh Infirmary. Di, those are the questions I have for you. Is there anything further that you would like to add?
Yes, there is, please. Yes,
Absolutely.
I've prepared a short statement here. Deciding to take part in the inquiry has troubled me a great deal, as it will inevitably lead to stern criticism of decisions, events, and people involved with the infected blood disaster. Over many years, I have received excellent care from many skilled and dedicated health service staff, for which I shall be forever grateful. The use of infected blood products, however, is an issue apart. It is an aberration in the otherwise wonderful history of the health service. When the horrors began to unfold, there was widespread fear of how bad this might prove to be. This led to a coalition of secrecy, I think, involving government departments, health service officials, and indeed medical professionals. Information was withheld from affected patients. They were not told enough, and frequently they were not told the truth. It should not take 9 years to find out that you have been tested positive for hepatitis C, and the condition progressed, of course, during all that time. Had there been more openness and honesty, better treatments could possibly have developed more quickly, and perhaps many lives could have been saved and many more lives less blighted. I have been one of the more fortunate ones, so thank you for hearing my story, and we wish you, sir, and your team all the best with what has to be a very tough inquiry. Thank you.
Di, I'm just going to turn my back and ask Mr. Dawson and Mr. O'Neill if there are any further questions they would like me to ask. Nothing further. Thank you, sir.
It remains for me to thank you very much, Di, for giving us your account and for your thoughts at the end. Thank you.
Thank you.
Well, Ms. Richards, we'll take a break now, a break when people can have lunch until 1:25. 1:25.